What I recommend for small DSOs is that you start your quality management program right away. Once you reach 5 offices, you should have at least one type of policy written. And that first policy for me is always documentation. What's so important about documentation? When I get some kind of grievance and I'm trying to help our doctors out, what's in the documentation? That is a legal form of paperwork. And if it's not there, it didn't happen.
Hey there, dental economist. If you're a dentist owner or a leader within a dental business thinking about growing production, case acceptance, patient and staff satisfaction, positive outcomes, and everything else that comes with running a dental business, then you're a dental economist, and you've come to the right place. Welcome to the Dental Economist Show. We're meeting at the intersection of profit and purpose as I sit down with dental leaders who share their stories about dentistry, business, and growth. Welcome back to the Dental Economist Show with me, Mike Huffaker. Before we jump into today's discussion, don't forget to like, follow, and leave a review wherever you listen to the podcast. Thank you for the support, and thank you for listening. Today, I'm excited to welcome Dr. Mariz Tanious, or Dr. T, the Chief Dental Officer at Affinity Dental Management, a leader with over 2 decades experience in both clinical and operational leadership. Dr. T is recognized for her ability to integrate technology into dental practices, to streamline operations, and improve patient care. She consistently contributes important insights to help others in the industry and can often be found on stage at conferences and events sharing her knowledge. Dr. T, it is a pleasure to have you on the show today. How are you?
I'm well. Thank you so much for having me. That was quite an introduction.
Yeah, I'll just follow you around, and anytime you enter a room, I'll walk in first and I'll introduce you that way, and then everyone will know. And we'll just make it a routine.
Sounds good.
I see you have a friend in the background there, emotional support dog. What's your dog's name?
His name is Chewbacca. Chewie. He's actually a service dog. He comes on airplanes with us and loves to go to Utah and jump in the snow. He's a very furry, funny animal. Not very graceful, but loving.
Yeah, I love Chewbacca is a great name. Is that one of the, is he a hypoallergenic dog? Like one that does not do any of the shedding?
Correct. Yeah, he's a Bernedoodle.
A Bernedoodle. Oh,
yeah.
We were looking at potentially getting a Bernedoodle at one point. So do you recommend Bernedoodles? Great dogs?
Yeah. Great dogs, like amazing, loving, super kind. The children love him. So he brings joy to everybody that he meets. So it's awesome.
Awesome. Well, thank you for the introduction there. Let's start chatting about your time at Affinity. You joined Affinity, I think, 3-4 years ago. Can you share a little bit about what your role is there and maybe kind of the overall mission that Affinity has?
So I'll start with when I joined Affinity. And the reason why I joined Affinity is because they really care about quality dental care. And to me, as a quality assurance person, that's the most important thing to me. And when I work at, DSOs, there's always that kind of fine balance of operations and quality. So when I heard Ari, my COO, and Craig, my CEO, talk about that, I was like immediately drawn to this organization. And so by me joining, I was really able to create these processes and procedures to ensure quality of care for our patients. And so that's really the number one thing that we are trying to accomplish here. There's always the operation side of production and revenue and EBITDA and all that stuff. But for us, it is part that, but it weighs heavy on the patient care. So that's kind of what I'm bringing to the table here.
Yeah, let's take maybe a further step back, kind of in your foundational journey of becoming a chief clinical officer. I came across a story that you had shared about a pivotal moment where you observed your father undergo a dental procedure. It seemed like that was a moment that really influenced your career. Can you maybe take us back to that experience and how you ended up in that room in the first place?
Oh gosh. So growing up, we went to our dentist, Dr. Pickett, and he actually had 5 brothers that were all dentists, and they were all practicing in this one location. It was amazing. So ever since I was like 5, I was going to this dentist. And by the time I reached 8th grade, I had kind of a deep interest in dentistry, but I wasn't really sure what it was about. And my dad unfortunately had periodontal disease. Growing up in Egypt and having that kind of, you could say most Middle Eastern men smoke a lot. And so my dad was a smoker, and so, he developed this disease over time, and him having diabetes and all did not help because obviously it's a contributing factor. But when he had to undergo surgery, which, he had all his teeth extracted, the oral surgeon, one of the pickets, he was an oral surgeon, Stephen, and he asked me, do you want to come and check it out with me and your dad, and you can assist me? And I said, okay. I'm an eighth grade. I had no idea what to expect. I was like,
Yeah.
this is crazy. So when he started extracting the teeth, and I was like, this is actually really cool. I wasn't kind of like creeped out or grossed out or anything.
Yeah.
So I was like, this might be a really great career for me because I'm helping somebody get back to health. And that's kind of where it started and really sparked my interest. And from then on, I was like, I'm going to dental school. I'm the first doctor in my family. And so for me, that was like a huge accomplishment when I did graduate dental school. My parents were very proud, but really going back to that initial moment of realization, and I don't know if a lot of people have this, but to me, it was like pivotal. Yes, it was definitely pivotal. And I just wanted to, from there on, I wanted to help people smile again or feel healthy again or be healthy. And that really has transformed over the years. What does that actually mean? And being a chief dental officer for a company, I'm able to do it at a larger scale. I look at our patients and I look at who's coming in and what is it that we're trying to accomplish for our patient care, right? What are we trying to do here? And I'm always preaching this to everybody, is always do the right thing. And you have to look at a patient comprehensively to understand their oral care and what it means to also prevent disease. So, that being said, it's a huge passion of mine. I try to instill in everybody that I meet. I'm like, you guys got to do this. So that's the gist of it, you could say.
Yeah. I mean, how awesome is that? You said Dr. What was his name that invited you in?
Dr. Stephen Pickett.
Do you think at that moment in time he had any clue, like the impact that would have on you and kind of the course that you took with your career? I think it's just kind of an incredible story that helps you kind of think about the small actions that you take on any given day and like the impact that it may have on somebody else that you don't even recognize it's having at the time.
100%. I mean, I don't even think he has a clue what I'm doing today. I mean, I believe all 5 brothers have retired, but while I was in dental school, I was still, I went to dental school at New York. This dentist was in Napa, and I was just kind of coming home, getting my dental visits with them still. And I would kind of catch them up on what I was doing in dental school. But, I was just a dental student. I didn't even know dentistry until I graduated and practiced and then got into this side of dentistry of quality assurance, where my mind was blown. I had no idea there was like a niche in dentistry that I really felt compelled to pursue. So that's kind of it. But I do take my story and my experience and I try to apply it to other students or even dental students that haven't quite made it into dental school yet. I do share my experience with them because I feel like if I do that, then maybe they'll follow the same path or a better path than I did. So I'm always hoping, for the best for people.
So share a little bit about that transition for you. You started first as a clinician, you moved into this kind of, or pursued this path of quality assurance, moved into leadership roles within DSOs. Kind of what was your thought process? How did you know it was the right time? And did it just kind of occur naturally, or was it something that you learned about these other opportunities and made a cognizant effort to pursue that path?
While I was pregnant, I was having some hand issues, you could say, that never fully went away after I had my child. So after many doctor appointments, I found out I had arthritis, and that kind of limited my ability to practice. And so I am kind of a young dentist with a new child, didn't know, what I was doing. And I had to think of alternative careers within dentistry. Okay. So I ended up reaching out to a lot of personal friends who were in DSOs. And to be honest, I didn't know what to expect, but they had introduced me to the chief dental officer of Western Dental at the time. And his name, Dr. Mindole, till today is one of my closest friends and mentors. But when I met with him, he kind of said, well, you don't really have a lot of experience in the dental field, so I'll give you a chance though. So he gave me a chance because he saw I was eager, and I told him, listen, I'm adaptable. I can learn fast. Just give me a chance and I'll show you what I can do. And he took that chance on me. And he gave me 1 day a week in the quality management department at Western Dental Services. And I was doing peer review. And I was the only woman who brought the median age of that department down to maybe 65. And, I walked in, it was very intimidating. I walked in my first day, and it was all these guys who had so much experience, and they looked at me like, who is this little child coming to be part of our cool quality management group, And so I felt like I constantly had to prove myself. And that's kind of like the story of my life since I was a child. I was a slow learner. I didn't speak English very well. Arabic is my first language. And, just growing up constantly in that, mental state of like, I have to do better. I have to be the best. I have to, so when I got into that QM department, I was like, all right, I got to show them that I know dentistry and I have to be cautious. So I blew them away. And every time, like, I got another day, 1 day went to 3 days to 5, then full time. And then, throughout that whole Western Dental process, I met, 2 other dental directors who I'm very close with and I speak to on a regular basis, John Luther, and Dr. Ron Inge. And both of those guys I highly admire, and they're amazing. And every chief dental officer that I met is so different from one another, in what they do. Dr. Luther is, he'll go to Sacramento and lobby, and that's something I like, wow, like I didn't know you could do that. Or Dr. Inge with his, trying to connect the health insurance world to the dental insurance world. And, he used to be the chief dental officer for Delta Dental. And so I just learned all these tidbits from everybody, because what I believe is, if you could learn from somebody, you make yourself better, but hopefully they'll learn something from me too. And I'll never forget this thing that, Dr. Inge told me towards the end of my career at Western. I walked in and I showed him something, and, he helped me with this letter that I was writing. And he looked at me and he said, you're better than you think you are. And I said, okay, all right, I appreciate that. And, he's like, don't let anybody tell you anything different. So I really appreciated that. That gave me a huge boost. And I ended up, not shortly after, but, a few years later, I left Western because I felt like I got everything I could get from Western. It's such a wonderful learning ground. And from there, I went to West Coast, where I became dental director there. So it was a pretty cool initial journey for me. And it all started with someone giving me a chance.
Yeah. Yeah. So you were leading the youth and women movement in the quality management of Western Dental. I'm curious, did others end up kind of moving into that role after you kind of opened the door for, hey, maybe some younger clinical experience would be worthwhile here and provide a benefit that we weren't getting previously?
100%. They hired like 3 people around my age too, shortly after that. And I helped train them, and, and it was great, because just because you're young doesn't mean that you don't have the experience necessary to do the job, right? You can also learn on the job. And again, it's, dentistry is one of those things where, yes, there's a clinical side to it, but there's also an administrative side to it. And understanding both is really important. And I believe in the power of learning and working hard, and what does that get you at the end. And it really is rewarding. And I'm able to now reach a lot of different people and a lot of different industries, even in medical industries. So I'm really excited about my position and what I can offer to the dental industry, but I love to learn from everybody. There's no one that can't teach me something. Like hey, tell me about your experience, because I could use it for my next endeavor. So it's pretty cool.
Yeah. So I have to ask, and this is maybe I'm a little embarrassed asking this question, but quality assurance in a dental organization is not a topic that I have frequently discussed with dental leaders on this podcast. And so, how do you define it? From your perspective, do all DSOs have this function within their organization? And if they don't, why should they? What's the argument for implementing or kind of, building this function within a dental service organization if it doesn't exist?
Well, that's a loaded question.
That's like 3 or 4 questions. I know. I kind of stack them up sometimes. So sorry about that.
No, it's okay. So quality assurance is a very large topic. Okay. It could mean a lot of different things to a lot of different people. Typically, you're basically creating policies and procedures for a company to ensure that our doctors are providing the standard of care. I like to think standard of care is minimum, right? So we should be above the standard of care. But for this definition, we'll say providing care at the, standard of care to our patients, and being able to have outcomes that are predictable, good outcomes. Okay. And what does that actually all mean? You can't measure quality. Quality, you can, it's very, you could say it depends on the person, right? Is a crown that looks like a big blob but has great margins, is that quality? Like I wouldn't think it is. But, that's my definition, is like, great emergence profiles and all this jibber jabber that I don't have to talk about right now. But how can we measure the outcomes? And that's what I'm really looking at. So, setting these parameters of measuring these outcomes kind of can tell you, are we giving our patients good quality? And those parameters are set, obviously, through the standards of care. There's different audit tools that you could utilize. And just, understanding dentistry as a whole, like if you have an open margin, is that poor quality? Yes, because eventually, that crown will get recurrent decay. The patient will possibly lose the tooth, right? So that's one aspect of it. Another aspect is there's like grievances that you have to like take care of. And grievances can be anything from someone at the office level complaining, to an insurance grievance, to a dental board grievance, to litigation or some kind of, legal type of grievance. You have to be able to measure that as well. How many are we getting? Why are we getting it? Who are the providers? Is there a pattern? There's so many things that you have to look at when it comes to grievances. And then how can we reduce the number of grievances? So those are all things that, I like to look at as well. There's also, risk management, which ties into the outcomes and the grievances. But how do you mitigate? And how can you ensure that you are not putting your doctors at risk and also putting your patients at risk? I mean, there's so many, it's so complex. And then there's also the compliance factor of everything. There's compliance from different organizations like OSHA and, OCR and all that stuff. But again, it leads into one bucket, which is quality assurance. You are the person that is bringing all the technology, all the latest information from all the different dental boards and dental organizations, and creating these standards for your company. So that's kind of a long-winded answer, but there's a lot more to it, but that's just on the surface, right? And then all of the DSOs I worked for have had a quality assurance department or quality management department. There are some that probably don't, and I would think those are the smaller ones in the states that are less regulated. In California, for example, they're regulated by the Department of Managed Healthcare. And that's like amazing, right? I mean, is it amazing? I don't know. So they're highly regulated in those states. But in other states, sometimes they don't even look at those processes and procedures in an upcoming DSO. But when you get your first audit from an insurance company, or you get like a litigation or, some kind of legal letter from a patient, that starts to kind of build up over time. And you're like, okay, how can I fix this? So a lot of small DSOs start off with just the one-off type of, let's fix this. Let's fix this, right? Like, so they have it's kind of like an ongoing process for them. But what I recommend for small DSOs is that you start your quality management program right away. I think once you reach 5 offices, you should have at least one type of policy written. And that first policy for me is always documentation. It's like, what's so important about documentation? And I don't want to, bore the crowd here, but documentation is one of the most important things. Like when I get some kind of grievance and I'm trying to help our doctors out, like what's in the documentation? That is a legal, your chart is a legal form of paperwork. And if it's not there, it hasn't happened or didn't happen. So I always talk about, and I preach to all of our doctors, proper documentation, timely documentation. And this isn't just in the dental world, by the way. The medical field has, I think, worse culprits than than the dental side do.
Of course.
But yeah, I mean, there's so many layers to it. But I would just recommend anybody who has 5 or more practices to just start off simple and make it like there has to be a process and certain guidelines that your doctors are following. So, that's what I would say about that.
At what point would you say that it becomes a full-time role? So, you're at 5 practices. I'm assuming that the doctor owner at that point is the one that is going to need to instill the discipline and start driving the documentation and setting the requirements for the other doctors across those 5 offices. But as you get larger, you just explained kind of a broad swath of areas that this touches that go beyond kind of the standard of care and go into liability management, grievances, documentation, process. How would you think about when this becomes a role, when you become large enough where you've kind of hit that critical mass where you need to find somebody to focus on it?
Yeah. So I would say, you don't want to, I would say 10 offices plus, you really need someone to manage those offices in a way where you're not going to be overwhelmed when you add another office. And the reason for that is, I think chart audits, I don't like to use the word audit, but assessments, of your doctors, just keeping them, in the loop of why you're doing these assessments. Those assessments take a long time until there's a more automated way of looking at those charts. I'm sure AI, with the whole thing with AI, that's going to be coming out soon of how you can look at charts, but also utilizing those tools like Overjet AI with the enterprise analytics. That also kind of helps you see like, where are you in compared to other providers, DSOs, and what are you actually trying to accomplish with your program, right? Are you only looking to just do chart audits? Then at 10, maybe not. But if you are trying to develop a true program and your plans are to expand and scale your DSO, I'd say 10 offices plus, you would need to start really documenting a lot of policies, relating to credentialing your doctors, relating to peer review processes if necessary. Again, grievance processes, how are you looking at it then? And all of those policies can be amended over time. So as you grow and as your company changes, you become more fluid and you could just change those according to what your needs are.
So let's talk a little bit about the chart audits or assessments, if we want the kinder, gentler, less threatening approach. When you're thinking about those, what specifically are you looking for? And what is the outcome that you are looking to drive by consistently completing chart assessments?
So initially, let's say like a new doctor comes on board and I want to see where they're at. Maybe this is a brand new green doctor, or maybe this doctor has been practicing for 25 years. I like to know where they're at as a baseline level. So what I like to really look at is, what is their documentation like? Are they, again, everything falls on the doctor. So if your assistant is taking radiographs and they're really bad, it's still your fault. You have to request those,
Of course.
So I look at all things in terms of that counts as documentation. I look at, do they care about oral cancer screenings? Are they doing it? Are they documenting it? If there's a positive finding in medical history, are they talking about it in their notes? Are they addressing it with the patient? Did they require a medical clearance? So a lot of it's like looking at the medical side of the patient, the documentation of what has occurred during that, those initial visits, or even post the initial visit of actual treatment visits. Are they putting in the necessary information for me to read it and get a story? Okay. And then from there, I look at the quality of work, the outcomes. And so I look at, all right, if they did crowns, can I see, did they take a bite wing of the crown? Okay. And what does that crown look like? If I find any deficiencies in that quality of work or the outcomes of the work, then it kind of leads me to say, all right, well, is this a one-off or is this a pattern? So from that baseline, I kind of just wait to see the doctor in like maybe a few more months. I'll do another chart review and I'll say, all right, let's look at now the outcomes that I can see. The patient came back 6 months later, had some radiographs done. What am I looking at? I'm looking at the fillings that this doctor did. Are there overhangs? Are there quality issues? If there are, and it's more than 3, it sparks a focus audit, a focus assessment. That focus assessment is based on that particular type of work, okay, that particular procedure. And that procedure then goes into, all right, I'm going to pick, 10 random 10 different fillings, right? And I'm going to try and assess that. But I'm going to first notify the doctor and say, hey, I've noticed there's some, possibly outcome issues. I'd like for you to be a part of this process. I want you to understand that we're looking at this to help you. And it's always that conversation. Doctors don't like anyone looking at their work. And it's uncomfortable. It's like, oh, am I a crappy dentist? No, you're not a crappy dentist, but maybe we can provide you with CEs that'll help you get to where you need to be. And honestly, most of my conversations with my doctors are always positive, and they want to be better. They want to get the help. And anyways, from there, you would basically do that chart, that focus review, focus audit, and then determine if this doctor really needs help or not. And the passing rate for that is, a 90%. So they could really only miss one. And from there, we have a different conversation, right? Hey, let's get you the work, the CEs that you need. I can mentor you. I mentor a lot, especially onboarding doctors. I think it's a huge, important thing that we have to do for all of our doctors, no matter what skill level they're at, how much experience they have, because dentistry is evolving and changing, and we need to kind of move in that direction. So I always say, like, if you can't change your ways or change different techniques or learn a new process, or, then you're kind of stuck and you're going to be left behind. So I want to make sure all of our doctors are moving in that, moving uphill and learning new things. So that's another thing about our, education program. We call it Affinity University. It's in its infancy, really. But, I can see from our chart reviews what we're deficient in as a company, right? Or what our challenges are. And then I could say, all right, we need CEs in this section here, right? And I always go back to the basics. Like, do our providers, either hygienists, doctors, are they good with the basics? Because that's the foundation of dentistry. And so from there, I build upon.
So I'm curious, when you're having these challenging conversations with a doctor that, maybe you've recognized over the course of 2 or 3 different audits that there's been a deficiency, is there often self-awareness that exists, or is the conversation normally a surprise?
It's never a surprise, because when we're interviewing doctors, we kind of like tell them like, hey, I'm here to mentor you and help you. And we're going to have meetings every other week and discuss, case studies and stuff like that. So it's typically not a total surprise.
Well, they know that it's happening, but do they
They know
know
it's
that
happening.
do they recognize their own limitations or areas of opportunity when it's surfaced?
Not always.
Not always. Okay.
Yeah. So sometimes I'll have conversations where I'll just put up a radiograph and say, hey, what do you see here? And then sometimes they're like, oh, I don't know. And I'll say, okay,
What's great?
Evaluate this crown or evaluate this, and I want it to come from them. I want them to recognize it, because being self-aware and being able to critique your own work is the first thing in dentistry. There are solo practitioners that don't have someone like me, breathing down their neck. No, I'm kidding. I'm not like that. There are solo practitioners that never check their work, never have audits, never have anything, and they get by throughout the year. But are they actually producing great outcomes? I don't know. Sometimes they do, sometimes they don't. And then there's another piece to it, which is ethics and, morals. Did you cement this crown on purpose knowing that it was bad?
Right.
And those are the conversations that don't always go well, which are very, by the way, in the last, I don't know, 11 years of me doing this, I really haven't had too many of those. I mean, I could probably count them on one hand, but usually the doctors are, oh my gosh, I didn't see it this way. Or, oh, I didn't know I had to take a bite wing versus a PA. And sometimes it's so basic and it's just it's self-correcting, but with now the help of AI, where it's really a non-biased opinion, right? It's like, hey, there's something there. You got to check it. Why, did you notice this? Why did you disagree with it? And I want to know, because maybe I'm seeing something different than they are. But it definitely, the AI, Overjet especially, has taken out that difficulty when it comes to doctors assessing their own work, because then they could really look at that and say, oh, shoot, okay, I see it now.
Well, let's talk about that a little bit more. So, you mentioned you guys use Overjet. I think the audience all is aware that Overjet is radiographic AI, and there's a kind of a suite of products that also surrounds that, related to analytics and other tools that you have at your disposal. What are the benefits that you see to having implemented radiographic AI inside your practices?
I mean, there are so many benefits I could probably write a book on, but I would say the first thing is, helping diagnose and treatment plan. Okay. So I'm a new doctor. I don't know what's going on. I just graduated, did my residency. You're in the real world and it's fast. You got to be prepared, So this kind of takes the guessing work out of stuff. And it's in your face, red for caries, there are PAPs on there, and you're just able to see kind of everything and say, okay, do I agree or disagree? And then there are times where AI is not correct. AI, again, is the ability of a program to read different shades of gray. Okay. What you feed it is what you're going to get out of it. So if you're feeding it really bad radiographs, you're going to get bad outcomes from AI. But, with technology improving and being able to take those radiographs and make them better, you're able to just discern, is this dental disease or not? And then take it one step further, giving the empowerment to our providers, whether it's hygiene or doctors, being able to start those conversations with patients is priceless. It gives you the ability to say, hey, we're using this technology. Can you take a look? I want you to be part of your treatment. And the patients then can kind of better gauge, right, what dental disease is. Because before, you would show them this gray scale of
no idea what they're looking at.
Yeah. And they're like, do you see this little dot right here? Yeah, that's decay. And they're like, yeah, but my tooth doesn't hurt. So, and then how do you explain that? Right. So this kind of gives you it's like a stepping stone to that conversation. And then really the third thing I would say is that it helps the patients take accountability for their dental treatment. It's we're going to now bring you into your dental treatment. You're going to understand dentistry. Now it's up to you. I can only do so much in the dental chair. What you do at home is up to you. Like, I'm not there telling you to brush your teeth. I'm not telling you there to wear, perioprotect trays, or I'm not telling you, like, you know what I mean? Like, it's like, how can we have patients be accountable? And that's one way of doing it, especially with like intraoral scans. We use Trios scanners. Just being able to take that initial intraoral scan and be like, this is what your teeth look like. See this crack right here? Like, it's there. I'm not making stuff up. So it really brings the patient and doctor together and to work on their treatment plan together and then hold that patient accountable. So I think it's a great tool.
Does the AI ever present findings that in order to truly validate requires that you drill? And is that a challenge from the treatment perspective, if it is the case, where a dentist, doctor is looking at it and it's like, I don't really see that. This is showing it. In order to actually know, like, you would have to kind of take that leap of faith of trust in what the AI is presenting and drill. Is that a scenario that occurs, or is that not an issue at all?
Well, I think it's important to understand that AI is just using great radiographs, right? You still need a patient attached to those radiographs, and your clinical exam will determine if you are going to agree with that finding or not. So if there's an ambiguous finding where you're like, it looks like it's there, I'm not sure, but something that like, that ambiguous, you could probably make that decision clinically. So when you look in the patient's mouth and everything looks dandy and fine, and you're like, I don't see it, I'm not, going to do it, or I do see it and I think we need to catch it before it gets bigger. That's where I would say you need both. You can't just rely on AI alone.
Yeah. What are some of the things that you are most excited about in dentistry today? You've been in dentistry for now, I said in the intro, 2 decades. And so when you look at kind of where dentistry has come from and where it's going, what are some of the things that you are most looking forward to?
Honestly, I mean, it's the technology side of things and how we can automate a lot of these processes in the office. Whether you're a DSO or a single practitioner, there are some amazing things happening that a lot of people don't know about yet, and there's certain things I can talk about and certain things I can't. But one of the things that we love is automation, and 32 Health helps us with that. 32 Health is we call it a credentialing platform that uses AI to scour the internet for primary source verification. And if all of this sounds gibberish to you, like, basically you need to be able to make sure the people that you hire are not criminals. So, that helps with that process. And then from there, credentialing and recredentialing for insurance companies makes it like a click of a button. Like, I don't have to do anything. So that's pretty incredible. And that for us makes it efficient. Especially if you have limited resources, this is the way to go. There's another thing that I've been looking into, the dental app. And I don't know if you know much about the dental app. It's a PMS system. It's called the dental app. And it is pretty amazing. So it's a cloud-based PMS system. And really the differentiating factor here is that you could take it's like basically layering sales and marketing CRM into the app to basically just work, in the dental app together with your patients. So you'd actually create targeting campaigns directly through the PMS for a specific, types of patient that, need braces or something. I don't know. Like, it's pretty incredible. And then it soon, I think we'll have a AI integration. So like an AI dental consultant. So if your staff, for example, is not sure how to do something within the app or want to learn how to create a campaign, which really for a single practitioner or a solo practitioner, this is something that is really going to be very helpful because they're not going to have the resources to hire a marketing person or hire, like a chief dental officer or chief whatever. So there's going to be like this AI consultant that basically will provide you the answers or provide you with, talking to patients in a nice way. You're chatting back and forth in the PMS system with a patient. How can I manage risk by saying something nice and not blowing up at this patient, So it'll help you really formulate those answers using the AI chat GPT technology. It's pretty cool. But, just again, it's the innovative field of dentistry that we're in right now, where things are constantly changing, things are evolving, and I want to be a part of all of it.
That's awesome. Last question, then we'll wrap. Where do you go to learn? How do you stay on top of the industry? I mean, there's so many things happening all the time, so many things changing, so many different ways to be a great leader. From your perspective, what is your mode or method of continuous learning to continually advance your career?
Well, first, I learned from the environment that I'm in. So, having access to a bunch of different providers with different personalities and understanding where we want to improve, that's one way of creating programs for those providers. And, maybe it's something that I am not, well versed in either. So it helps me. Another thing is, keeping up with all of our vendors. We have wonderful vendors and they offer so much education and new products out there and new technologies out there and different procedures. I learn a lot from our vendors as well. But what I like to do is I read a lot. I read a lot of different, dental journals, different dental articles, whatever's out there, I try to read as much as possible because that's how you're going to get ahead. And also reading things that are not dentally related, being able to understand how to manage people and how should I be a leader myself. One of my favorite books is called Surrounded by Idiots.
Yes, we read that in our book club.
It's so great. And it sounds hard, but it's really about understanding people's behavior and their personality traits and how can you communicate effectively with those people. Because I'm a different type of...
What color are you?
Oh, God. I think I'm a green blue or something like that.
Green blue? Okay.
Yeah.
You like to have all the information before you make decisions.
Yes. I'm slightly analytical. Actually, I'm very analytical, but I also kind of step back and look at my surroundings and be like, is this safe? Can I say this? But, that being said, understanding the psychology of all of the people we work with is extremely important. I can't lead the same way, or talk to someone a certain way and then use that same method with someone else. It doesn't work that way. But then when you're in a group together, it's how can you get everybody on the same page, especially with group projects. And so it's really understanding people's psychology and what's important to them. And then from there, building upon that. So I love books like that. I think it's super helpful. And I love that, the servant leader. I'm a servant leader. I believe in, boots on the ground, being with my people, wearing scrubs in the practices. I don't practice dentistry anymore, clinical dentistry, but I like to sit chairside and look at what they're doing and talk to them and talk to everybody in the office when I go in there. I spend about 30% of my time in the offices and just talking to, front desk staff. I sit and observe and I look at what are we doing in the office and where can we improve and what are we doing really well? And then I like to highlight that to the team. So, that's kind of my goal here is always looking to improve and, giving credit where it's due, building a great culture. I want to be approachable as a leader and making sure that I'm down to earth. I think I'm down to earth, but.
If you're green, you got the green in you, you're probably pretty down to earth and approachable, which is good. It's those scary reds that sometimes you don't know how to deal with. So, well, Mariz, Dr. T, it was really great to chat with you. We'll have to do this again sometime. I think we opened up some new topics here at the end of the conversation that we could go into much, much greater detail in the future. But thank you for joining. It was a real pleasure having you on the show.
Thank you so much. This was a lot of fun. I appreciate it.
Absolutely. The Dental Economist Show is brought to you by Planet DDS, home of Dental OS. To find out more about how cloud-based dental software by Planet DDS helps unleash dentists and their staff to focus on patient care, visit www.planetdds.com. Stay tuned for upcoming episodes by following wherever you listen to podcasts. And thank you for listening.